Welcome, everybody. It's nice to see some different faces here. This is always exciting for me to do some training, and each time I do this, I add a little bit of different twist. You'll see some models in front of you that we're going to get to a little later. My goal today is not to teach you anything. My goal is to share you some of the things that I do and my experiences and things that have worked in my practice, because it's all about keeping it simple and practical and being able to use it right away in the professions that you do. And I think that's the critical part. So I'm just sharing my experience and the experience of my staff that's here as well. Just want to welcome you to the Aesthetic Learning Academy, but I also want to mention, if you haven't been in this facility before, we dedicated the second floor conference center to our father, Dr. Samuel Shatkin, who was not only our mentor, obviously, but our partner for many, many years, over 20 years that we worked with him. And through his knowledge and support, he created such a great foundation for my brother and myself. So we dedicate this whole conference center to him, and we're excited to at least share that with you, because it's just a wonderful opportunity for us to really sort of remember him and try to think of him all the time, which we do. In case you don't know, there are women's room and the bathroom in the back and the men's room over to the side here. Just if you have to get up and move around, that's fine. There's plenty of time, since especially we're starting early, that we'll have a chance for questions if you want at the end of when I talk. So we'll try to keep it rolling, and then we'll have time for socializing too, because I think a lot of the interaction that you're going to get from someone I can offer, my nurse Kathy, who's here with us, and even some of the other professionals here, it's just going to be a lot of interaction that we can all learn from each other. So I think that's a lot of fun. And Dr. Tharp, of course, and thank you for that nice introduction. So I'm going to start with my first talk here. We're way on schedule here, and it's going to talk a little bit about beauty, balance, and aesthetics. And our grandfather, my brother and my grandfather, wrote poetry books, limericks. He actually wrote 13 limerick books during his lifetime, and they were all really fun little quips. And he wrote this one back in the 70s. This is well before I was a plastic surgeon, although his son-in-law, my dad, was a plastic surgeon. But he wrote this one about it. So I think I could argue with him now, because I think we really can do some things to, help us look back in the mirror and say, hey, I still have that youthful look that I had when I was younger. So basically, what we're going to talk briefly about here is beauty, balance, and aesthetics. And the reason why that's important, whether you're in a medical practice or a dental practice, is because you want to try to put everything together. And I've had the unique opportunity to work with my brother all these years. So during that time, we've had a chance to interact and exchange patients. And my brother will say, Sam, can you do some, lip enhancement on her? And I said, okay, well, when are you going to, finish up with the denture? Then we'll get her in the room. Or how are you going to replace one of these missing tooth that's giving her a little bit of flattening in the cheek? So it really helps the patient get a holistic approach to what they're trying to achieve. So really what we're going to do in the course of the day, and particularly this particular lecture, I'm going to talk a little bit about the medical aesthetics and how it's a little different from a general medical or dental practice. Some of you that do aesthetics right now are appreciating how the aesthetic patient is so different. The aesthetic patient is the type of patient that you really have to do a lot more hand holding. It's not like they come in, with an emergency problem, either a mole, or they come in with a abscess tooth that you got to fix. These are patients that come in that want to look better, and it's a little bit different type of clientele. We're going to discuss the neuromodulators predominantly, which is the Botox and products like that. I'm going to touch on the fillers, which we've actually got a couple demo patients that I'm going to be doing treatments on, and then we've got some demonstrations that the hands-on for the participants here are going to have. So that's going to be really good. I might touch briefly on skincare. I think the overall wellness and aesthetics that I get involved with includes that, and I think that's pretty important. And then we're going to talk about the use of the modulators, neuromodulators specific to the dental practice, which I think is important. And you're really going to learn some of the important anatomy. And as I said before, our goal is to give you the gist of what you need to know to really feel confident to go ahead forward and use these products. The anatomy is very complex in the head and neck, and we all know that. Our goal is to try to pinpoint the spots, and I say that no pun intended, but we're going to pinpoint the areas that we're going to put that needle and make sure that we get the results that we're trying to get. And then we're going to promote the aesthetics. But the expanding the knowledge is so important, and then you're going to share that with your patients. So when the patients come in the office and they're coming in for something different, then they're going to see that you do aesthetics. All of a sudden they're going to say, well, besides Botox, what else do you do? Well, I can do some veneers on you. I can do some skincare for you. So all these things are working synergistically. Really, aesthetic medicine, just by definition, is really the non-surgical approach. What we're doing to try to create this beauty. The surgical aesthetics is different, and as a board-certified plastic surgeon, I do that every day. In fact, I still love the surgery. So for me, it's a nice balance between what I can do in the operating room, what I can do for the patients in the treatment rooms. But it's really a combination of relaxing the muscles, reducing the fine lines, reinflating and restoring the natural look. And whether you're treating someone, I gave a lecture in New York City about 2 months ago, and the topic was beautification from 8 to 80. So I'm like at odds. I'm trying to think, how am I going to talk about beautifying someone when they're 8 years old? But we do a lot of things like protruding ears. We take care of deformities on the face like cleft lip and palate irregularities. So really, it's more about recreating form, and that's what we do in our practices. And some of you that heard me speak briefly yesterday, or Thursday I should say, I talked a little bit about the total patient experience, because it's not that pot at the end of the rainbow. And if you just look at the pot at the end of the rainbow, which could be equated with the financial gains from the doctor's standpoint, I get more satisfaction from my patients when I actually get a hug or get a beautiful letter. I had a letter last week from a patient of mine that I did some liposuction on, but regardless of the treatment, you get them to open up, and all of a sudden they start to feel so much more confident with the way they are and the way they feel, and you can see it. They come in with a smile on their face and they give you a hug, and that means more than anything. So the goal should really be not to look just at the rainbow or at the pot, but you want to look at the rainbow, because if you just spend your time looking at what's at the end, you miss all the splendor of that rainbow going to the end point, which is so incredible, and that journey is just wonderful for patients and for the doctors. So even at that young age of 8, there's certain facts that we want to try to make sure to seek out that beauty and the balance. And these are a few quick tips that I like to use. And when you're talking about needling people, you want to remember that if you bruise them, you're going to lose them. That's not totally exactly true, but if you understand that the patients come in for aesthetics and they don't want to have the downtime, and you come up with recurrent issues with these bruising, you want to remember that you might not keep those patients, and they're going to go somewhere else. Most of the time they come back anyway, because they realize wherever else they go, the doctors aren't trained properly like you will be here, and they won't get the results they want. Another thing I like to say is, if you make them look weird, you're going to be feared. There are doctors in this community, which is a little bit different probably in Los Angeles and Florida, because they can do a lot more excessive things there. But if you remember that our goal is to be natural and conservative, to try to recreate some of the youthful appearance and natural balance in the face, then you're going to be fine. If you're trying to exaggerate things, and maybe some of the things I teach you today will help you understand that, then they're going to come back to you, because they're going to know you care and that you're practical and you're an honest doctor, and you're going to give them the results they want. Thirdly, if you pain them, you won't retain them. That one I can say for sure. If the patients are uncomfortable, okay, and we're not just talking about hurt from the needle, if you walk them through the process and help hold their hand essentially through that process, they're going to feel a lot more comfortable coming back to you. So they're going to feel the pain with a needle that I put in, just like they would with any of you. But the goal is to try to make them understand that and prepare them for that, and then they get through it, no problem. One of the things that's really important, and I got this information from Dr. Swift, who is an amazing injector, and he likes to break down the patients when they come to the office into why they approach the aesthetic doctor. So the women that come are really beauty seekers. The number one thing that women come to the office is to look more beautiful. They don't really come in and say, I want to fix my nasal labia folds. They don't come in to say, can you take this mole off? They just say, I want to look more beautiful. And then a lot of times the practitioner has to be the one to look at that and try to help them figure out what it is that they can help them with. So the number 3 reason that the women come in is a little bit different, because they actually want to look more youthful. For the men, on the other hand, it's almost the opposite. When I talk to men when they come, they want to look more youthful. A lot of times they come to the practice because they want to look youthful in the boardroom so that they can be competitive and people perceive them having youthful ideas. So that's really important for the men. And so it's a little bit of a different twist. So I like to consider the women to be beauty seekers and the men to be youthful contenders. All right, so they're trying for that. So what's really interesting is the number 2 reason that women come in is to find a rich husband. And that's really true. They did these surveys several years ago. So the women are coming to try to find rich husbands, and the men are trying to become more youthful. And their number 2 reason is to try to find a beautiful woman to marry. So I like to think that as plastic surgeons or aesthetic doctors, we're really the reason why mankind hasn't become extinct yet. Because the men and the women are looking for each other. They just look for it in slightly different ways. And I think that's a bit of a stretch, of course. I can't really make claim to that. But really, our goal is to do these things. We're trying to enhance beauty and bring back youthfulness. And that's really what they're looking for when they come to a dental practice or a plastic surgery practice for cosmetic purposes. They're coming to enhance the way they look, to look better in front of others, to try to be perceived as more balanced and beautiful. And those are really some of the key concepts. Other key concepts which are really interesting, and in the preparation for these talks, I really learned some things that I didn't think I really knew, and I probably had studied at one time when I was taking Psych 101 in college, but that's been several decades ago. But what's really interesting is one of the things about aesthetics is it's innate. If you take a baby, and this is a baby that has no preconception of beauty and aesthetics, and they have 2 people in front of them that they're looking at, they're going to be focusing on that beautiful face and beautiful balance. So why is that? Nobody taught this child that the shape of the eyebrows or the openness of the eyes or the line of the jawline are what's critical in beauty. But they do focus on that. Not to say that the father's not good looking, but they tend to focus sometimes on those beautiful faces. So it's really interesting. The other thing that's interesting is plainness is a penalty and beauty is a premium. So that's rather interesting too, because it's not uncommon that the beautiful woman that's vying for the same job as an average-looking woman, by presentation and facial appearance, will probably get the job before the other. I mean, I don't think that's really fair, but that's the penalty. That's what's going on, and it happens all over the world. It's not just in the United States. So we need to think of that. And when it comes down to extending beyond the borders of the United States, this is really universal. These beauty aesthetics are universal. You take Angelina Jolie and put her in a picture somewhere in Asia, she's going to still have that appearance of being aesthetically beautiful. The skin color may change and things like that. So this is sort of a universal thing. Angelina Jolie used to say that she struggles with low self-esteem all the time, but it's really more of a psychological problem with her, not the way she looks, of course. Because the physical attractiveness is so important. And these are all studies that have been done over many, many decades. There's no secrets here, but it's very, very easy to understand how people really perceive beauty. They look at balance, and that balance is going to come from science, and I'm going to share that with you in just a little bit so you understand that. This Newsweek article, which came out of 2003 November issue, was really interesting. This is a composite of beautiful features that they put together. This is not one person, this is a composite. And they take the complexion and the round eyes from the French, the Irish, the Canadian ancestries, all these different things, and they put them together to create this, what one would perceive as a perfect face. And everybody globally will perceive this as beauty, which is rather interesting. This is a really neat video, so I want you to watch this. And it's, let's see if we can get play. So what they did with this woman is, we're trying to figure out what our perception of beauty is. So what they really did was they took this woman who's got some beautiful features, and then they did makeup on it. And this is sort of like a makeup artist on steroids, and maybe cocaine too, because they took her and they started to make these changes to her in just a few moments, and you'll see the changes that occur here. They're working on the hair, they're working on the makeup, realigning the eyes, highlighting certain areas. Some of the things that we're actually going to do aesthetically, did the updo, really made it beautiful, but in some cases that isn't enough. So what do we do next? Then our perception of beauty isn't enough to do all that. Now we have to do Photoshop on her. We'll stretch her neck, we'll tighten up her jawline, we'll raise up the eyebrows a little bit, and all of a sudden she appears on a billboard, and that billboard is showing a beautiful advertisement for some makeup. But in reality, that's really not beauty. I think we're taking it a little bit too far. In fact, Dove, which was the sponsor of this program, you sort of wonder what the perception of beauty is. It's really distorted because you took somebody that had beautiful features, and now you're stretching them on Photoshop and have to take it to that extreme. So you really wonder if that's really what our perception of beauty is. But I can tell you what the perception of beauty is universal, and I mentioned that before. So I'm going to ask everybody that's here, I want to have a show of hands. Who thinks number 1 is the most beautiful feature up there on those pictures? Number 2? Number 3? Anybody for number 4? How about number 5? Got a couple for 5. How about 6? Most people say 6. I could have told you that a long time ago. 5 and 6 are traditionally, whether you show these pictures in the United States or anywhere else in the world, are the most. Now these are composites. These are not pictures of somebody, some person, but they adjusted those images. And 5 and 6 are beautiful. And the reason why it's beautiful is because they all fit within this golden ratio. They all fit within the beauty ratio that was determined long time ago. This particular woman, her name is Florence, she was selected in 2012 as the most beautiful British woman because she's got the perfect balance. And when you went to study that, you'd see that balance is just part of what they call the golden ratio. And the golden ratio is a pretty interesting phenomenon. This particular woman has, I think it's 20 plus different measurements that could match into that golden ratio. And the golden ratio, I'll explain in just a minute, but it is 1 to 1.618. And that golden ratio, which has been used for aesthetics and building and architecture over many generations and centuries, it really helps define this. So when that little baby was looking at the innate appearance of that beautiful mother versus the average looking father perhaps, they were looking at this innate phi relation, this golden ratio. And that's really pretty interesting. So you can see, going through the process, we can really see each one of these golden ratio measurements allow for this perfect balance. So we don't know that. We don't really know that this person's exactly measured. But when it comes down to it, when you go back and analyze it, the beautiful person will have these proportions, which is really pretty interesting. This goes on for a while, so I'm not going to belabor it, but I just want to make sure that you can appreciate that every part of the face fits within this golden ratio. So the golden ratio is pretty interesting because these measurements, which we would actually be able to do, like I just showed you in that last video, is actually something that happens in the split second. 5/100ths of a second. We'll be walking down the street, and all of a sudden, I might see Angelina Jolie out of the corner of my eye, and that split second, I knew that there was something beautiful over there to take a look at. Okay, it happens in that short a time. It's what we call the blink effect. That blink, in a blink of an eye, you'll see something that you'll appreciate as beauty, or you'll see something that you don't appreciate that way, and then you might just move your gaze somewhere else. The golden ratio can actually be measured, and this is science in medicine, which is really pretty neat. What we find is that the phi relationship is actually the measurements of 1 to the opposite end, which is 1.618. And those measurements, again, can be used in all areas of life. So when we're taking a look at the beautiful face, that phi proportion can really define that area of beauty, just like I showed you in that other video we just showed. So here are the numbers. Every part of the face here falls into that category. Whether they got lipstick on or makeup on or not, they still have those balances. And when the makeup artists are trying to put that makeup on, they're trying to enhance those features so that they can make it look better. And I know in dentistry as well, and I think Dr. Tharp might mention this later, you use that same phi relationships when you're using it to design the width of the incisors versus the centrals versus the laterals. It's all part of the same proportions. And also phi relation extends beyond that. This is my brother's Corvette. Maybe you saw it parked across the street while you were here this week. He bought that car, and actually he used to get to work at 7 o'clock every morning. Now he gets there at 5 to 7 to get to start work because it's a little bit faster than his previous vehicle. But the interesting thing about it is these beautiful vehicles, whether you're talking about an Aston Martin, you're talking about a Corvette, you're talking about a Ferrari, these beautiful cars, which are sometimes ranked the most beautiful machines in the world, all fit into this phi proportion, which I think is really remarkable. The other thing is I asked my graphic artist how she designed our logo, and she said she just did it. But when she was in the process of doing it, she started to realize, or she didn't even realize this, but she was doing it on her own as an aesthetic graphic designer, that it did fit into this. So when I went back later and analyzed this, now I had start to see how all these areas figure into this phi proportion, the golden rule. And that's what looks aesthetic. And I've seen doctors at plastic surgery meetings that have been presenting that actually do their presentation so that the slides are exactly in the phi proportion. so that the title will be exactly the same dimensions that we want for the rest of the picture. So I don't think I went to that extreme. Please don't look at these slides that carefully. But the point is that sometimes we appreciate things a little bit better. So we've all been to a lecture where we see sloppy slides and we sort of lose interest and we start fidgeting and look somewhere else. If you got something that's aesthetic, we'll spend more time looking at that. So what is really the aesthetic destination? So the goal is not, when we're talking about fillers and we're talking about Botox, the goal is not just to stick a needle in. We could almost train a monkey to do that. The goal is to find that perfect sweet spot, just like a golfer when they hit that golf ball. That thing has got to hit in the perfect sweet spot so it goes the distance. But if you're driving down the street and you drive past your house where you were supposed to pull into the driveway, you've gone too far. And if you stop too soon, you've got to walk to get to your house. So the goal is to hit that perfect destination, that perfect aesthetic point where you're going to reach that goal for you. And that is the golden ratio, I believe. And I never really used the calipers and golden ratio until last year because I really didn't think of it aesthetically. And what I do currently in my practice, and I'll show you the calipers that I use, I will actually do my markings where I want them, and then I'll pull out the calipers and just to reconfirm. And in most cases, I'm pretty close, but not always. Our goal should always be to get the optimum. So I do that, and I'll adjust it a little bit. But it's something that you might see aesthetically, like the graphic designer I mentioned before. She puts everything in place. If she were to go back, she'd probably be really close. So sometimes we have it, sometimes we don't. But if you want to really become that aesthetic doctor, then the best thing to do is to use these tools, like the calipers that I mentioned, to try to get that appearance. Because what'll happen here, and I think this is a pretty good example, Angelina Jolie, if I were to just show you her lips, you'd know exactly who she is. You wouldn't even have to see the rest of her face. It's just, characteristic. And something interesting changed when she came into play, because all of a sudden people are coming in for fillers in their lips, and I do that all the time. The problem is, if we're doing fillers in the lips on somebody that really has a very narrow face, the balances don't work. And I've sort of done this little graphic here for you. Obviously, that's a little exaggeration. But what is interesting is what happens in this particular case when we take this, woman that's beautiful, we take the size of the lips to be proportional, and now we change that. And that's Angelina Jolie's lips on that person. And everybody would agree that we like her aesthetically the way she is before that. We don't like it the other way. And the reason for that is that, and the reason Angelina Jolie looks so beautiful is because not only are her lips in exact 5 proportion, but the lips relation to the width of her face are in proportion. So if I, as an aesthetic doctor, would go in and narrow her masseters and take that face and make it more slender, because she's got really prominent jaw, I can go back and show you that picture. If we took those masseters down, all of a sudden she would not have a good proportion on her face, and those lips would look enormous, just like they did on that other woman. So that's really something rather interesting. So when you're looking at it again, it's the whole patient experience and the whole outcome of what you're trying to reach at the end point. Because just to go back a little bit, this golden ratio, this beauty ratio, is something that's been around forever. Venus de Milo, the Stradivarius violin, these are all fit in this proportions. And this is, Michelangelo knew this, Albert Einstein knew this. These are things that Leonardo da Vinci, obviously, these are things that we really need to appreciate. The balances, the Parthenon, these are all done in perfect proportion. And if I were to go and look at the building that we have across the street, which is this rectangle, I believe that it would be in those proportions as well, because that's what the architects know about and learn about. So why don't we learn from them? So let me just take a quick swig of my water here. I'm going to go on to the next step. So this is what I consider to be the great 8 features of facial beauty. The face shape. Generally that oval shape is what's beautiful all over, universally all over the world. The forehead height, the eyebrow shape, the size of the eyes, and the inner eye distance. And that's the first measurement I do with the 5 proportions. I measure the inner canthal distance. The nose shape, the lips, the skin clarity, and the skin laxity. So what's interesting to look at, there's a couple things that we can't adjust. We can't affect with a needle. Forehead height, we can't change that at all. We also can't change the eye size and inner canthal distance. But all the rest of these things can be adjusted with certain aesthetic treatments that we're going to be doing. We can relax the muscles to change the shape and appearance. We can reduce fine lines, we can reinflate the face and volume, and we can restore a natural look using some treatments like skin care and various things like that. So I'm going to go into a few areas that we can adjust that, and I'm going to show you some examples. We can soften lines and reverse aging. How do we do that? We can raise the eyebrows by putting some filler in the lateral brow. We can raise the eyebrows by putting Botox in the areas of the muscle, and I'm going to teach you that today, that are otherwise being pulled down. We can do some skin treatments. This particular patient had some photodynamic therapy done, where you put some certain topical products on the skin and you actually treat it, and it'll exfoliate the skin and give it a brightening look. So all these are results that you can achieve with that. We can't change your forehead height certainly, but we can certainly change that. So when we go into the area of reducing lines and wrinkles, these are typical examples of patients that do well with this. Here on the left side of your slide, I'm showing an injection and a demonstration that we did. We're going to do plenty of demonstrations today to show you. This is a typical male patient that's bothered by the frown lines there. Just so you know, I've had Botox on my face for about 15 years. My nurse Kathy's been doing it for me. I think it's the greatest thing in the world. I still have plenty of expression on my face. You know, the goal is not to make everything plastered or flat. The goal is to make it look natural. And there's nothing wrong with trying to soften things up, unless, of course, you're an actor or actress, in which case you really have to have those expressions. And I've had some individuals come here, and we have to really adjust and tweak that, because they would be a problem if we totally paralyze all that stuff. And that's what can happen with Botox. So let's look at a couple areas of Botox. This is a patient, actually she's coming back today. She's going to be one of our models later today. And that's me on the other side there. And that's my trust in my nurse, because she's right over there. But this one, we're injecting some platysma muscles, the bands in the neck. This is the Nefertiti lift. I'll show you a little bit more about this later. And this is how simple it is. It just takes a few moments to do. And this is our selfie video on the right-hand side there, but the other video. This is how really easy it is. It just takes a few minutes to relax these platysmal bands and muscle bands in the neck, and it can really make a big difference.
These injections are done deep into the muscle. The one at the root of the nose is more superficial.
And I'm going to teach you that today as well. The angle of the needle is very critical. I'm going to show you how to do that.
Along the root of the nose.
I'm giving her the instruction here. I think this was the first time she did it, so you can see how easy it is, right?
By the procerus.
Okay.
Okay, good.
All right, it's on YouTube in case you want to watch it again. But this is really what we can do. So by injecting the crow's feet, for example, we can inject a few areas around the eyes, and we're all going to have a chance to experience that on our facial dummies in front of us here. And also we're going to have a chance to actually do it on some of the patients for the hands-on that we're going to do later today. These crow's feet can be done, but you have to place it in the right areas, of course. When it comes down to restoring volume, here's a perfect example of restoring volume in the lips. We can enhance the appearance of the lips to give more fullness there. For someone, again, that has a wide face, it's perfect. If we have somebody with a real narrow face, you might not want to put quite as much there. And a lot of Asians have high cheekbones, but very heavy masseters. Sometimes we want to build up the anterior portion of the face. So by building it up, you can see the before on the left and the after on the right. We can give her a little bit more angulation to the face. You know, what the injections and the masters can help. And we did inject her on this particular day, but I don't have the after pictures. But see, by increasing that volume in the cheeks, it can really give a nice enhancement. And then you can also put some filler at the root of the nose. This is a patient that I did some fillers. Same patient, right at the root of her nose and the radix. You can see how that gets built up. All of a sudden, the balance of the face changes dramatically just by adding more volume there. So we can really make for a nice improvement there. I think you can see right in here, we added that volume there. Here the eyelashes are extending beyond the root of the nose. Here the eyelashes are not extending beyond the skin. Very interesting phenomenon. And then you got the gummy smile. These are pictures of a well-known celebrity, and when she was young, she had the gummy smile. So all we need to do is find the right muscle that's causing that retraction, which is the levator olecranon, and we inject in the right spot. We relax that muscle, and all of a sudden they still have their smile, which are the other muscles that pull up the face, but they won't pull up the lip in that area, which is creating all that gummy smile. Now we know in the dental profession that there are some patients that need shortening of the teeth, adjustment of the gums to change that gummy smile. And in our practice here, we do a combination sometimes. If the patient's only problem is the muscles are pulling too much, I'll inject them with the Botox. If the patient's problem includes some other things that are a dental area, then my brother takes care of that, and we can get him a nice and natural smile. So here's a good example. You put the neurotoxin exactly in the right spot, just above the nasal oblique fold, and I'll show you where that goes later today, and you can get some nice improvement. Just for completeness, to cover all those grade 8 features of facial aesthetics, I just want to mention that there's a lot of things we can do for skincare. Sometimes they fall into the realm of a medical practice or a dental practice. We can actually do, while the dentists are doing tooth whitening, we can even do some facial peels, and we can do facial alginate masks to help rejuvenate the skin. So there's a lot of things we can do. But the goal should be, again, when the patient comes to the office, they want to look more beautiful. The goal shouldn't be to just say, let's do your teeth, let's do your smile, let's do your lips, let's do your forehead. Let's take a look at the whole patient and see what else we can offer them. In our practice, there are plenty of tools. I'm going to go over many of these today. The tools that we use include Botox and Xeomin and Dysport. Those are the 3 neurotoxins that I'll cover today. We'll also show you some of the fillers that we use. Some fillers are hydroxyapatite. Some of them are hyaluronic acids. There's nuances to each of those, and you'll learn about that as well. So again, as I mentioned in the very beginning of this talk, we talked about what I'm going to share with you, share you my experience in facial aesthetics, maybe give you a little bit of background knowledge in the basic science and maybe the basic anatomy for those of you that need a little refresher course, but also talk a little bit about the rest of the things that really make for the overall beauty and aesthetics. So in conclusion, we're going to have a little fun today. This can be a new source of revenue in your practice. If you're interested in doing that, if you just want to have the knowledge to share with your patients and refer them to other doctors, that's fine too. But you can really provide complete rejuvenation if you take the time and explain things to the patient. You can really have a lot of satisfaction from that. So after that's complete, I'm going to ask if there's any questions about what I just talked about. Everybody was nodding. Yes, sir.
What's the difference between the Botox and dermal fillers?
That's a really good question. Botox is a neurotoxin which paralyzes muscles. Fillers are volumizers or filling valleys. So a lot of patients come to my office and say, you know, they want their lips filled, can you put some Botox in there? Okay, that's a misnomer, obviously, a misunderstanding. So when we look at the face, we have to determine what it is that they might need. A lot of times the patients don't always know that. So if a patient comes in and they've got a deep groove here, they may actually be a candidate for both a neurotoxin to weaken the muscles that are causing that to develop, as well as a filler. And in that scenario, we would do the neurotoxin first, have them come back in 2 weeks. If they've still got that deep groove there, then we can fill it up with one of the dermal fillers. So it really depends on what they're looking for. But most patients that come in that haven't had this done are confused about the differences there, and it'll be pretty obvious by the time we finish today's course. Yes?
When we start the treatment on a particular patient using these, it's always a temporary solution if we don't do it again. Is that correct?
That's correct.
So is it proper to tell the patient, you got to do this the rest of your life if you want to maintain this look?
Well, there's a couple ways to look at it, okay? First of all, the good news is it doesn't last forever. So if they're not happy with the result, it will go away. The bad news is it goes away. And some people like the results. So it's not uncommon that they keep coming back. In fact, we typically reschedule their Botox every 3 or 4 months. And once they start up, they'll know exactly how long it's going to be. So the first time we'll have them come back in 3 months, and if it's still working a little bit, then we'll say come back in a few weeks, and then we'll time that every time regularly. But yes, they are temporizing. But in a plastic surgery practice, for example, maybe Mrs. Smith wants to come to the office for some rejuvenation, but she's not quite ready or doesn't want to have the surgery at this point. So we temporize things until she's ready for that. But one of the things that's also interesting is I still do Botox on women that I do facelifts on. Because if they've got, you know, deep frown grooves here and they don't need their eyebrows lifted, then what am I going to offer them? I'll just relax those muscles. And it's sort of maintenance. You know, women especially, and about 90% of my practice is female, they come in, you know, regularly to get their hair styled or their hair colored or whatever. They get their nails done on a regular basis. So these aesthetics are so important to them. So coming in routinely every few months for Botox or every year for a filler, because the fillers last longer, it's not uncommon and they do it often. So if somebody's got a real bad gummy smile and they're not happy with that gummy smile, and you can change that, then they're going to come back, guaranteed. If you're going to make it just right for them, they're going to be happy.
Is that part of informed consent or?
Oh, I always tell them it's temporary. Yeah. That was the question was, do you let them know that it's temporary? Yeah, I tell them everything. I tell them my facelifts are temporary. And they always say, when will I need it again? I say 5 to 10 years. It's different, everybody's a little different. But with Botox, it's pretty regular. You know, every 3 to 4 months, maybe 5 months if they're fortunate, it'll last a little longer. And there's some products that last a little longer. The Dysport has the advantage of, they say, lasting a little longer. And you might want to consider using Dysport, and we're going to show you about that, talk about that later today too. So yeah, you want to let them know. You know, just like you tell them a veneer, you know, may last 10 years, it may last 2 years. You might eat on some popcorn and catch a kernel and break the veneer, and it's going to come off. So, you know, one of the things when you're talking about an aesthetic patient, this is probably a good chance to discuss that, is you can't guarantee things. You know, if somebody needs their tooth extracted, an impacted tooth or something, you're going to take it out. I guarantee that tooth's coming out. Okay? But when it comes to aesthetics, you can't guarantee, and you don't want to guarantee. You're going to say, look, I'm going to do everything I can to get you the result you want. That's our goal. That should be everybody's goal. In general medicine and general dentistry, that's the goal. But you also know that nature is nature, and the surgical hands or the hands that the practitioner has are limited. We can be guided by our knowledge, guided by God or whoever, but you know, there's some limits to that, and the healing process too. So we don't make promises, but we tell them we'll do everything we can to get them to where they want to be. That's what I try to do. Any other questions? Yes?
I recently heard from a friend of mine saying that you mentioned about topicals on the face.
Right.
What about the stem cell? They say you use stem cell now.
That's a good question about the stem cells. Well, currently you can't really say that you're treating somebody with stem cells. But in my practice, what I do is we actually do something called PRP. PRP is platelet-rich plasma. It's what you saw, some of you saw what they do with the dentist. They draw the blood, they spin it down, they take the fibrin, the platelet-rich fibrin, which develops some volume. But in plastic surgery and aesthetics, what we do is we spin it down, but we're taking the fibrin out. So we've just got the platelet-rich plasma. It's the serum, the yellow serum. And then what we'll do is that has all the growth factors in there. The platelets have the growth factors. So we actually inject that into the skin. It has been called the vampire facelift in the past. I personally don't like that terminology much, but what we're trying to do is stimulate healing. So we can use that for when we do microneedling, we can use that when we do laser treatments. We'll use it topically, the PRP, we'll use it injecting it below the surface of the skin. So there are some things that may be perceived as the stem cell type rejuvenation, but at this point we don't really call it stem cell, but PRP is good, and there's skin products out there that they call stem cell products. I don't think that technology is there yet. Any other questions? We're well on schedule here, so way ahead of schedule. Anything else? Okay. Well, if that's the case, then I'm going to go on to our next topic, which is going to be specific to the neurotoxins.